Hello, my name's Professor Debbie Shawcross and I'm Vice Secretary General at EASL. EASL is the largest professional body in Europe devoted to liver health. Our overarching goal is to spread knowledge and expertise in best practices and the latest scientific breakthroughs in the field of hepatology. EASL also advocates at national, European and global levels for patients, caregivers and all who are impacted by liver disease. In 2020, an EASL Lancet Commission reported on the status of liver health and care across Europe. A key message of this report was a call to action for health professionals, nations, and the international community to implement a significant paradigm shift within liver care. This paradigm shift included an emphasis on the prevention of liver disease through evidence-based public health measures that reduce per capita intake of alcohol and unhealthy foods, and tackle obesity, viral hepatitis, and of course stigma. In recent years, EASL was able to count on the key support of MEPs, and we would like to express our deepest appreciation for their unwavering support and commitment of the MEPs, Friends of the Liver, to advancing liver health initiatives in the European Parliament during the current term. Their dedication to this cause has made a significant impact on our efforts to improve the lives of individuals affected by liver diseases and their families across Europe. EASL would like to reiterate evidence-based recommendations to the European Union institutions for the next political term to address boldly the human and financial burden of liver disease in Europe. We can no longer ignore the enormous impact on millions of lives across Europe and on health budgets in every country. As we move beyond the European Parliament elections and the new European Commission is appointed, we will work intensively with our sister organisations in public health and with the EU institutions to accelerate the changes that are urgently needed. Here are our key asks alongside our public health peers in the context of the election. Thank you.
Hello, everyone. My name is Jörn Schattenberg. I'm the director of the Department of Internal Medicine 2 at the University Medical Center in Hamburg, Germany, and I'm a member of the EASL Public Health and Policy Committee. Metabolic dysfunction-associated steatotic liver disease, or MASLD, is highly prevalent, a chronic disease that affects up to 1/3 of the adult population and 1 in 10 children. The disease shares common metabolic risk factors with obesity, type 2 diabetes, and cardiovascular disease. The burden of MASLD is expected to further grow in the coming decades, with wide-ranging implications for public health and healthcare systems, and of course, high costs, both direct medical costs, but also indirect socioeconomic costs. As a hepatologist, I'm concerned about liver cancer and end-stage liver disease. A road to prevention and improving unhealthy diets and lifestyle choices is urgently needed. This requires a coordinated action in Europe to implement evidence-based health care policies directed at reducing behavioral risk factors and improving healthy environments. Such health measures for all policies could include efforts to increase the affordability and availability of healthy and nutritious choices, in particular for children, increasing taxes on sugar-sweetened beverages, and measures to protect kids from high-fat, high-salt, and high-sugar products. Of course, implementation of school-based education programs aiming at the children, but also the families that support these children, and interventions focusing both on physical activity and healthy dietary choices are urgently needed. Thank you.
Did you know that 1 in 2 people who dies from liver disease in Europe dies as a result of alcohol? A key message in the EASL Lancet Commission was a significant paradigm shift within liver care, with an emphasis on prevention of liver disease through evidence-based public health measures to reduce per capita intake of alcohol. Alcohol causes enormous harms, both personal and economic, within Europe. Alcohol causes 3 million deaths per year and 1 million in Europe. In addition to causing half of all liver deaths, alcohol also causes 7 cancers, injuries, violence including domestic violence, suicide, road deaths, and crime and social harms. All of these deaths, all of these diseases, all of these harms are preventable utilising evidence-based measures to reduce alcohol consumption within the general population. And these recommendations are found within EASL's Alcohol Policy Statement on Reducing Harms and HEPA Health 2. And they are summarised as follows. First of all, the EU and all European countries should devise and implement a strategy to reduce alcohol harms. Secondly, we should reduce affordability of alcohol through minimum unit pricing of alcohol products and increased excise duties. Thirdly, we suggest a complete ban on alcohol marketing and advertising, including on social and digital media, and a complete ban on all alcohol sponsorship of sports and events. We recommend utilisation of an alcohol licensing system to restrict the hours of alcohol sale, the density of alcohol outlets, and the separation of alcohol in mixed trading outlets. We recommend introduction of strict legislation and enforcement out of a minimum legal age of purchasing alcohol of 18 years. We suggest strict enforcement of drink driving countermeasures. We suggest mandatory health warnings and ingredient labelling of all alcohol products, including cancer. We recommend a levy on the alcohol industry to recoup the costs of alcohol harms, a cost currently borne by the taxpayer. This levy could be used to fund treatment of alcohol-related illnesses, social care, justice costs, and research. Thank you.
Viral hepatitis affects over 3 million people worldwide. 9 out of 10 people living with viral hepatitis are unaware of their diagnosis. The disease is the second leading infectious cause of death globally. According to the WHO 2024 Global Hepatitis Report, every day estimated 3,500 people die from viral hepatitis. In the WHO European region, an estimated 15 million people live with chronic hepatitis B and 14 million people are infected with hepatitis C. According to the WHO, viral hepatitis could be eliminated as a public health threat by 2030 if appropriate measures are implemented now. EASL calls on the European Union the following activities for viral hepatitis. The European Union Council recommendation on HBV vaccine-preventable cancers should be perceived by the EU member states to close the vaccination gap for the newborns, children, adolescents, and adults at risk of contracting viral hepatitis B. Address the gaps in country policies regarding the lack of hepatitis B vaccination in key adult populations. Recommend enhanced awareness on transmission prevention testing and the benefit of treatment for HCV elimination and HPV disease control. Increase investment to integrate within health system and scale up hepatitis case finding, screening, diagnosis, and treatment, simplifying hepatitis responses. In selected community settings as harm reductions or drug services, treatment of key population must be emphasized alongside harm reduction measures to reduce infection burden and prevent new infections. Improve health literacy on prevention of viral hepatitis-related cancers by making use of the dedicated funding in the EU Fourth Health Work Programme. Encourage partnerships and innovation agendas that prioritize new technologies, service delivery models, and health system practices that overcome stigma, discrimination, and other key barriers to achieving progress toward viral hepatitis elimination. Address social determinants of health and decentralized service delivery, prioritizing outreach programs for marginalized and vulnerable populations affected by viral infections, ensuring that services are culturally appropriate and responsive to community needs and tackle social and structural barriers. engage empowerment communities and civil society, including key and affected population, and support their pivotal role in advocacy, service delivery, and policy making, to advancing research for improved diagnostics and potential vaccines for hepatitis C and cure for hepatitis B.
Hello, my name is Peter Jepsen, and I'm a member of EASL Policy, Public Health, and Advocacy Committee. And I'd like to share with you the following messages to the European Union. In Europe, the number of deaths from liver cancer has doubled in the past 30 years. And around 80 to maybe 90% of patients with liver cancer also have an underlying chronic liver disease. And this strong relationship between chronic liver disease and liver cancer means that prevention and treatment of chronic liver disease equate to primary prevention of liver cancer. So we have the following 7 messages to the European Union. First, educate health practitioners and the general population on the potential prevention of liver cancer through physical activity, healthy eating, and avoiding smoking and excessive alcohol consumption. Second, develop evidence-based multi-level public health interventions that reduce the disproportionate burden of liver cancer placed on marginalized and vulnerable populations. Third, address the essential activities for the integration of social needs into liver cancer health policy. Fourth, raise awareness about liver cancer screening as a means to reduce mortality from liver cancer. Fifth, introduce liver cancer screening for high-risk groups into national strategies. Sixth, improve access to better disease management and integrative care for all patients and ensure the highest standards of care for all. Seventh, set up specific liver cancer patient registries to collect and share data to advance medical knowledge and clinical practice. And those were the messages from EASL's Policy, Public Health and Advocacy Committee. I'm Peter Jepsen. Thank you.